Hi, my name's Cindy Martin. I'm a psychiatric nurse practitioner in private practice, and I've been in private practice for 20 years, specializing in the treatment of anxiety disorders. I prescribe medications as well as do intensive psychotherapy. And in this video today, I'm going to address some of the common questions and answers that people have about the medical aspects of anxiety disorders. So the first question people ask me, why do I have this? What's wrong with me? What's causing this? Why can't I be normal? So the answer is this. First of all, it's in your genetics. It's the way you're made. So people with anxiety are made like a bunny rabbit or like a deer in the forest, that the nervous system stays on hyper alert, looking for danger. This can be a good thing. This isn't really something wrong with you. It's just the way you're made. Because people with anxiety like this that stay on hyper alert are also very high energy, very creative, intelligent. They're the shakers and the movers of the world because you think fast, you move fast, you get things done. You're a first responder. So even though this very active, high energy, quick triggered, alert adrenaline system causes you to have anxiety episodes, which are uncomfortable, it also gives you a lot of good things. Like I said, you're the first responder. You're a bunny rabbit or a deer. You're not a sloth. So if there's a bunch of people sitting around at a swimming pool and a toddler slips into the water, you're the first one to jump in the pool and grab that child. Pick that child up, hand him back to his mother, who was standing there talking, didn't even see the kid fall in the pool. That's a good thing. So the problem is, what causes the anxiety is, like I said, your adrenaline system is normal. You're on hyper alert, looking for danger, but it's a little hypersensitive. And sometimes it has a faulty timer. And the adrenaline system goes off when danger's not present. So understand this. Adrenaline is a normal hormone in your body that when your brain perceives danger, immediate life-threatening danger, it triggers the adrenaline system that gets your body ready to fight, flee, or freeze. That's your protector. It's a normal survival thing. So when you have a little bit of a quick trigger, it's going off when there's no danger present. And then what you experience as an anxiety attack is the body changes, the heart pounding, the sweating, the rapid shallow respirations, the slowed down digestive system that make you uncomfortable. So that's what's happening inside your body. So why do you have it? Partly genetics, partly it's the way you're made. What also can make it a little bit worse is if you were raised in an atmosphere of trauma. Past traumatic experiences, people that come from abusive childhoods or people that have been in combat. What's happened is if you have lived in a world where there is a lot of danger going on around you, and you're genetically wired to be on high alert, your brain is getting trained to have a little bit of adrenaline, a low dose of adrenaline, of that hormone secreting to keep you ready to run or fight at all times. So past trauma can be a contributor to current anxiety. The next question people ask me all the time is, well, so what about medications? Let me address that. what we like to do is the group of drugs that is called selective serotonin reuptake inhibitors, or SSRIs, are the medicines that turn down that hypersensitive adrenaline system and can prevent some of your anxiety attacks. SSRIs are the common medicines that you've already heard of because they're also antidepressants. But these are the medicines like Prozac, Zoloft, Celexa, Lexapro, Effexor. And these are the medicines like that you've heard of as antidepressants, but they're also anti-anxiety agents because they turn down that hypersensitive adrenaline system and prevent a lot of the anxiety attacks from occurring. Or if they do occur, they are less uncomfortable. Now, if you're watching this video, you've heard about taking benzodiazepines. Benzodiazepines are tranquilizers. They're the ones you know well: Xanax, Klonopin, Valium. And these benzodiazepines are unfortunately not as effective. Let me explain why. They're often given to people when they have their first anxiety attack and they don't know what's happening to them. And they don't know that it's just normal adrenaline in their body. So they think the body changes of the adrenaline getting you ready to fight or run away from danger are dangerous. So the person thinks they're having a heart attack, or they think they're going to pass out from being too short of breath. So they run to the emergency room. And they're in the emergency room, they're examined and reassured that it's nothing serious and told it's just anxiety, and often given a prescription for Xanax. So, if I'm having an anxiety attack right now, it comes out of nowhere. I'm not in any danger. There's no attacker. But my quick triggered adrenaline system has gone off. And now I am flooded with this high energy state, and it's making me really uncomfortable. And I have an urge to fight my own body and trying to stop my heart beating. I'm trying to stop the bad breathing. I'm trying to stop the upset stomach. Or I want to run away and get help. If when I'm in that state, I take a Xanax tablet, that Xanax tablet goes down into my stomach, and it takes about 30 minutes to dissolve and get into my bloodstream before it starts to calm me down. By that time, my anxiety attack has passed. My brain has caught up with the recognition that I'm really not in any danger, and it has turned off the adrenaline anyway. So then what happens is the person that's taken the Xanax and the adrenaline is already turned off on its own, the person comes to believe that it was the Xanax that stopped the anxiety attack. It was that your brain turned off the anxiety attack, turned off the adrenaline on its own. Now, this gets complicated. Sometimes, so the way we treat people with anxiety is, first of all, we teach them what adrenaline is. We teach them how to handle it with behavior therapy, which is basically to tolerate it until it passes on its own. If you know it's just adrenaline, it won't hurt or harm you in any way, and you allow it to pass and it ends without medicine, without running away, without trying to get help, it can last just minutes. And you don't have to have any panic attacks. So we teach people how to turn their panic attacks into momentary blips on the screen where they're anxious for minutes, even seconds. Then, if that doesn't work, we'll start them on an SSRI to help them work with their education and their behavior therapy to get their anxiety disorder under control. Occasionally, a person will be prescribed a long-acting Xanax, like Klonopin, to take in the morning before they face their day, to try to turn down that hyper alert, that hyperactive adrenaline system, to prevent some anxiety attacks during the day, only with people that are suffering greatly and not long term, only until they've had the education to start handling their anxiety attacks on their own with behavior therapy. That's what I love to do for a living. I teach my patients how to handle their anxiety attacks and without medications. And yes, I prescribe medications when I need to, but I also get people off medications so that they have the experience of success of retraining their hyperactive adrenaline systems and desensitizing themselves to the fear of having anxiety, and they get well. So yes, often medications are indicated, but not always, and only in conjunction with behavior therapy. One last question that people always ask me, even when they're getting better. I want to get rid of it completely. How do I get rid of this completely? And my answer is this: you can't. I already explained to you that your nervous system is very active. You have a very active brain. You do a lot. You're a busy, moving, you think fast, you move fast, and you're always going to have a little hypersensitive adrenaline system to stay on hyper alert. You're probably going to worry more than other people. You're probably going to look for problems that are a little exaggerated, and might obsess about how to get control over preventing any bad thing from ever happening in your life. Those aren't terrible things to live with. So yes, you can get rid of life-crippling anxiety attacks and panic attacks. I have treated many, many, many patients that had panic attacks and anxiety attacks for many, many years even, and their lives were completely ruined and crippled by anxiety. But when they use the behavior therapy I teach them, and maybe plus minus some medications, their anxiety episodes are seconds to minutes, blips on the screen of their normal day. It doesn't stop any of their normal activities. So no, you can't get rid of your adrenaline system because you would die without it. Adrenaline is your protector. You can't survive without it. If you were driving down the street and a car pulled out in front of you, you would need your adrenaline to swerve and slam on the brakes and save your own life. So you don't want to get rid of it. Can you get rid of panic attacks? Most definitely. That's the joy I have of treating my patients. I have so many files in my file cabinet, case closed, that haven't seen me for years. Because no more panic attacks. No more having their lives ruined by it. Just a few little adrenaline rushes, a few little states of high alert, like the bunny rabbit or the deer in the forest during their day, but nothing that interferes with their life's functioning. So I've made 2 other videos with the specifics of what you need to know to do this behavior therapy specifically. I have one video on what you need to know, and I have another video on the actual steps to take to handle an anxiety attack. So I hope you'll look those up and watch them. Thanks for listening.